Today, I'm here with Stephanie Koch, Director of Human Resources for Hendry Marine. Stephanie, thank you so much for being here. I appreciate it. I love your wealth of knowledge and experience, and I can't wait to ask you some questions.
I'm happy to be here. Thanks for having me.
Yeah, thank you. Tell us just kind of a little bit about your background, who you are, how you got into human resources, and like what makes you tick a little bit.
So I actually have been working in HR for, over 25 years. And I got into HR when I was working with a national company back in New Jersey. And there was a director of HR that I admired. And I asked her at some point if she was ever hiring, if she would consider me. And at that point, I was like kind of in an admin role. And I was also going to college part-time at night to get my degree. And we ended up connecting because the person that was working for her retired, and she came to me and asked me if I wanted the opportunity. So I had a wonderful mentor in her, and that's how I started in HR. And I always felt compelled to do better, always help the employees, be approachable. So those are great lessons that she taught me. But on a personal note, I live in the Tampa, Florida area, and I am a mom to a special needs son named Jacob, and he's 16, and we have a great time together. So yeah, I do a lot of this because of him.
Is that I was looking at your LinkedIn, you are a self-proclaimed health nerd, which I love because you and I are kindred spirits that way. The other secret I'll share too about you and I is that most people probably don't know is we both have a broker's license.
Yes.
Right? You do. And we've both taken the certified value health advisor training.
Yes.
Right? You took that. So did I. I think we might have been in, were you in the very first one?
I was.
Yeah. Okay. So I hadn't met you then, but I was in that as well. And I've only sold one health plan. That's not my goal necessarily. My goal with that, and I'm curious to hear what yours are. I know I'm asking you a couple questions, but
that's okay.
What was your goal in getting a broker's license and then the certified value health advisor certification?
So it's actually a funny story. So I was working for a company when I eventually got transferred down to Florida back in 2000. I was working in HR, regional HR rep type position. But anyway, through the years, I ended up at a couple different companies. But the company I was working for before Hendry, that is when I learned, the non-traditional, as I call it, healthcare space. So unfortunately, back in 2019, the division of the company that was supporting my salary, which was the majority of it, ended up shutting down. So I was going to be losing my job, and somebody knew how much I really loved this healthcare space. So they actually approached me and said, "Hey, we know how much you love the space. You have so much knowledge from an HR perspective. We'd love for you to come and work with us." And it was a boutique broker. And I thought, man, this would be an interesting left turn for me to take in my career. I've always been, and now I'm more interested in healthcare than ever. So I went and started working on the broker side. And when I started working on the broker side, I thought it was important to get my license. So that is how I ended up with my healthcare license. But it actually, it does help.
It does help, right? To have some more understanding, more knowledge.
Mm-hmm.
And then that certified value health advisor certification. You probably knew a lot of that going into it, but what were the big takeaways from that?
Oh my God. I'm trying to think, because that was a while ago that I took that. But I think it's always good to, you have a knowledge base, but there's always information that you're going to learn more of. I mean, I can't remember specific things, but, I think it's just the way the healthcare system works and is misaligned. It really does help you have a better understanding. So those are particular things I remember.
Yeah, there's a lot to the whole healthcare system for sure. Let's go back to that original notion of health nerd, because I love that. And I think in the role you're in, that's awesome to have such sort of personal drive behind that. But where'd that come from?
Well, having worked in HR for so many years, working for bigger companies, I specifically remember working for this one company for 11 years. We had over 600 employees, but we were always fully funded. And every year they'd come in, and we would broker jump, right? So we would broker jump every 1 to 2 years, depending on who would bring us the best proposal. But always during the renewal process, I would always think, I don't understand this math doing these manual adjustments. And I thought, like, I don't understand this. So when I finally got to my company before Hendry, they were self-funded, and that was my first exposure to it. But I always thought it was this really scary animal and thing I wouldn't understand. We were self-funded with one of the bukas, and I got to understand it more. But then when someone presented us with, an reference-based pricing outside the box type of healthcare plan, and I understood what that meant, because it was really like a peek behind the curtain.
Yeah.
Then I started to really dive into it. However, I will say I was not a fan when I first heard about it. I was an HR person that was saying, there's no way this is going to work. And I don't like this, because it was so different than what we had been trained to understand in our HR world, and because I had been doing it for so many years, it was scary. But after I learned more about it, I knew it was the right move.
Do you think that that's what holds back innovation in the employer space, becoming self-funded or expanding services in a self-funded plan? Is it HR who's just unfamiliar with it or scared of it? What do you think holds that process or progress back?
I think it could be a lot of different things. It could be that, the HR person is not familiar with any of the concepts related to self-funding,
Yeah.
and or the executive team is not familiar. And a lot of times it's, the advisors, the insurance brokers that may not be bringing those solutions. And, it's a combination of different things.
Yeah.
And there is, it is a big change or shift to move from fully funded to self-funded. But for companies that have 50 or more employees, they may be a good fit for it, and they really should look at it.
Right. Yeah. You mentioned broker jumping. Now I know you're a broker, and full disclosure here, Henry Marine does have Regenex as part of their health plan.
Yep.
Yep. And you had it also at a previous company, so you were familiar with it. So thanks for adding it to your
Absolutely.
adding it again. But how do you go about looking for or selecting, or what do you look for in an advisor now, so you can have some stability? And I've got some other spin-off questions from that. But what is it that you look for in an advisor?
Well, when I came to Hendry in 2019, they were blessed to have been working with a One Digital broker, and who was fantastic, because I think it's important for an advisor or broker to understand not only the business, but the people inside of the business, and also what the tolerance for change of that company is. And Hendry was at a point where the healthcare spend was not sustainable. So we were ready to start making some significant changes. So, the broker really needs to be aware of, like I said, the work environment, the people, tolerance for change.
Yeah.
And also, I think it's important that there's a plan laid out. It can't just be, let's make a change because we got the best rate, because sometimes the best rate doesn't equate to great benefits.
Right. And, sort of along that line of best, not just price, but about the people. What I love about what you're doing is you have an on-site clinic, right? Primary care
Yeah.
clinic, walk-on clinics.
Mm-hmm.
tell us more about that and how it engages with your employees, and curious what your advisor thinks about that, and if he brought that solution to you, or if this was your idea.
So I had actually been wanting to do something like this for a long time, even like 2 jobs ago.
Uh-huh.
And when companies would explore like the concept of a brick and mortar type clinic for their employees, it's a very large expense.
Yeah.
That the ROI could take 3 to 5 years or even longer. So going back to the other part of the question, back in 2021, we were doing a claims review. And then the beauty, of course, of being self-funded is you have a lot of data. So when you look at the data, you're creating your strategic plan, and you know what lever to pull related to what's going to help facilitate positive changes in the plan. However, in June or July of 21, we're looking at the data, and glaring was the fact that only 15% of our employees and their covered dependents were using the preventative wellness benefit. And we all know in the ACA, it's covered 100%. So that right there was an aha moment that we needed to do something to help facilitate our employees having access to convenient care. And interestingly enough, the majority of the 15% that were using it were the dependents. It wasn't even the employees.
Mm-hmm.
So at our shipyard, we have the majority of our employees are male. They're late 40s, early 50s. And, those are times of our lives where more preventative care needs to be done.
Exactly.
So, knowing that, we knew we had to take action. So the following month, I was at an HR Florida conference, which I've been attending every year. And I'm walking around thinking, hopefully we'll find something. So we're walking, and lo and behold, there is Walk-On Clinic. And I looked at it, and I went inside, and I looked at my colleague, and I said, this is it. This is what we need. It was like right away, it was like a match. And because I understood that they were mobile, and they could really fulfill what we needed. So by January of 22, they were on site 1 day a week. And we actually decided right away, part of the strategy was going to be, we weren't going to charge the employees to go to the clinic. Their dependents that were covered on the plan, as long as they were 16 or older, could go to the clinic. The employees don't have to clock out. So they were going on company time.
Mm-hmm. Yeah.
And really, the reality is that what that did was it made it a very positive opportunity for the employees to get the health care they needed. And it also helped productivity. We sustained productivity because they're not leaving for a half a day or a full day to go to the doctor. But the funny part of the story is that I'm a very positive person. So I'm thinking, if we build it, they will come. No. No.
Yeah.
They actually, the first impression by the employees was, why does the company want to know what's going on with my healthcare? That's my private business.
Right.
So again, that was January of 22. So right away, I'm like, okay, we need to do something to help drive engagement to the clinic because there was so much to offer. And I said, okay, we're going to do a contest, and we're going to, for anybody who went for their preventative wellness exam, would be entered into a drawing for 5 days of PTO. And it was like a 3-month window.
Uh-huh.
Now, interestingly enough, during that 3 months, some of the first patients or employees to go as patients, one of them went in and he was just trying to win PTO. And the doctor, did his examination and said, hey, did you know you had a lump in your neck? And it turned out he actually had cancer, and he had no idea.
Right.
I mean, that right there basically paid for the 1 year of having the clinic on site, and then some. Another employee goes in, and, I tell this story, it's like emotional, goes in and his blood sugar is so high, he's almost at stroke level. So because we made a conscious decision to make sure the staff at the Walk-On Clinic was very well trained on our healthcare programs, they knew immediately to obviously get him the medication he needed and the support but they also enrolled him in our diabetes program that the company pays for. So we created this whole healthcare ecosystem, even connecting a local network of doctors that have, practice specialty medicine that can't be handled at the clinic.
Yeah.
And it drove up utilization. By May of 22, we had already surpassed, the full year of utilization for the year prior. So we knew we had something that was going very well. And since inception in 22, we have been adding services like blood work. We do sports physicals, return to school physicals for kids. We're now doing, Garden, some testing, like blood testing for colon screens.
Yeah.
And we're doing medication that's being delivered on site. And it's typically the top medication that's being used, and that's at no cost.
Yeah, those are all such good things to help make healthcare convenient. I've been a clinician for over 30 years, and to your point about catching that first cancer, I can't tell you how many patients I've seen over my career who don't have a primary care provider,
Right,
are over 50 and never had a colonoscopy. I
right,
remember seeing one guy with hip pain, and I pulled up his imaging, and he had a bone cancer. And I was like, I'm never going to help you. This is not, you don't need me. You need
right.
to go,
It's too
do you have a
late.
primary care provider? No. And same, just story after story like that, that people either, especially men, these are all men, either
Yeah,
ignore, they don't pay attention to, and it, potentially could be disastrous for them. So making it convenient, I think, is just so important. And then to your point on meds, right? So many people don't fill prescriptions. It's a
mm-hmm.
hassle. It's expensive. If you can pick them up at work where you're going to be every day, 5 days a week,
For free.
for free.
So
Yeah.
again, it's removing every barrier to care. And you're right. I mean, I'm an HR person that is very protective of my company, but even more so the employees. So, people will approach me about certain products or a vendor or whatever. It's great that it would cost less, but how is it going to impact the employees? So I'm always looking out for them, in as much as I look out for the company.
Yeah, that's great. And I know Dr. Patel. You've introduced me to
Yeah.
on, and I love working with him. Right,
Mhm.
he's a great man. The team's great. But what I love about it is, and I do this in plans who have Regenex, if they have primary care on site, near site, direct, whatever. I try to connect with all those clinicians, tell them about what we do. He was very interested. He
Yeah.
has our brochures. He knows what we're looking for. He understands our prior auth process and who the right referrals are. And I love it when a clinician is behind all of that. So he gets into the weeds with us, as I imagine he probably does, as you mentioned earlier, with like your diabetes solution and other things. And that's
Yeah.
invaluable to have that hub connected to all the spokes so people aren't going everywhere.
Yeah, and it helps give them more advocacy and support that they may not otherwise have just calling a traditional buka. And in our
Right.
case, providing this service to them, they are so comfortable with the physicians now that we're on our third year. And we have like the Regenex brochures. It's like there are 3 treatment rooms. So it is a true primary care doctor's office that maintains the records, and we are hands off other than making sure that we're helping, pull the levers that need to be pulled and creating the strategy that's long term.
How did you handle, because I've heard this before, we're going to the company doctor. You kind of touched on it, but did initially people felt like maybe you'd be in their business? Has that since passed?
Yeah, that's what I was saying. So we held the contest, which drove up utilization to the
Yeah.
clinic. And interestingly enough, 2 of the employees that were diagnosed with serious health conditions became our biggest champions. And with them being out in the shipyard, sharing their experiences with other colleagues, that really helped drive more utilization even after the contest ended. And it really helped that the physicians that we hire are bilingual. We have a big Spanish speaking population, and they are great with the employees. They really made such great personal connections. And the one thing that was important too was even though they're here 2 days a week, they offer telemedicine services. So really it is an ongoing support that they have.
Yeah, that's awesome. How much, like, I know you got to probably be doing other stuff than healthcare, but
Mhm.
is your in your role at HR, but how much of it is healthcare and how much of it is what else? I'm sure PTO and I mean I don't know. What else
Yeah.
does your day consist of?
Well, I choose to spend time on the healthcare because is a strategy. And you may have heard me say this before, Mark, but when I really got into the weeds of this type of healthcare strategies, like about 8 years ago, it dawned on me. I said, a lot of every company every year spends time creating strategic plans on sales, how they're going to increase the sales and revenue and an operation efficiency plan. But nobody talks about a strategic plan for the second largest expense in the company,
Yeah.
which is healthcare. So I choose to spend I mean, a good amount of time on what's going on with the healthcare plan. However, I have a wonderful department that supports the day-to-day operation, but, I get involved in employee relations and, other high-level things like compensation and, you know,
Yeah.
so.
So I have an interesting question. I read an article just last night about diabetes and type 2 diabetes, and they were looking at, I forget, like 1 million veterans, and they were looking at zip codes. Now, we know social determinants of health, right, play about 80% of the role in people's health and disease. And certainly they noticed in this study, I'm going to do a little talk about it, using zip code as a biometric. That's my title.
Yeah,
So, because you can tell where people live, how ill they're going to be. It's just as good a determinant of health as anything else,
I
zip code.
agree. Hmm.
How much do employers want to get in the weeds with their employees talking about the social determinants? I mean, if you live in a food desert or if you have, you know, problems at home or you live in a neighborhood where there's more violence than needs to be. I mean, how much of a role can you play, and how much of a role does an employer even want to play in that? Because it is affecting you, but now you're
Yeah.
really getting into someone's business.
Yeah, I mean, there's definitely a line you don't want to cross and being too personally involved. I mean, you want to get involved to the point where you can offer resources and information,
Yeah.
to help the employees and their families. But it is important to understand, population health. Like in our population, our top 5 prescriptions are diabetes. So we know that's a huge problem in our employee population. So, every employer needs to dig in where they believe it's going to really help the good of the whole.
Yeah. Right. Yeah. So making those, just pulling the levers you can pull, you sort of
Yeah,
said
that's why I
earlier.
say you can only pull so many levers at once because if you pull too many, you're not going to know what's working better than the other, right? So,
Which leads me to, how do you start the process of vetting and, well, first looking for and vetting a solution? You knew us, so you knew what we could
yeah.
do, but are you looking at new things this year? And again, how do you go about finding them and then vetting them? And what's your ultimate end goal with bringing in a new solution?
So, as far as I'm concerned, I think networking and referrals are super important. I think that if you have great relationships with people that you trust and they know someone that can help, expand the benefit profile, I would start with, people that know someone that I might need to talk to.
Mm-hmm.
I think that's really important. And one of the goals that we have this year that we're working on is a wellness initiative related to mental health. And that is something very, very important because we have 2 employee assistance programs, but like a lot of other companies, they're not very utilized, very low utilization.
Yeah.
So I did start talking to like Dr. Patel. He referred us to someone that he knows that provides mental health services that we may consider bolting on to the walk-on clinic. But then I was also referred to somebody else here locally that is very reputable that I recently met with. And I think she has some great resources for us. So we're kind of weighing our options. But I think referrals is really important, but then you have to lean on your insurance advisor too. Like One Digital is fantastic with us.
Yeah.
They know I'm like a mad scientist with all this stuff. So I'm always bringing something, but I make sure they're involved, because I don't know what I don't know and I might be missing something.
Yeah, that's great. I'm glad that you work as a team that way. Real quick, back to mental health. I think this is such an important topic, and I'll just give you another example, like how, everybody's health problems live in a silo to them. And sometimes they're a clinician. I was treating a patient who had chronic low back pain, leg pain, wasn't getting better, had a 2-level fusion, didn't help. I mean, he's looking at a revision now. I mean, and he's not even 60. He's out of the workforce now. And this isn't going to make him better. I don't go in and tell them this isn't going to make you better, but I know it's not. Nonetheless, I start probing him and asking him questions. Why isn't he getting better? What's going on in your life? Nephew suicide, son suicide, daughter, sister, stage 4 breast cancer. And I'm like, how you holding up? Boom. The floodgates blow up, right? And I was like, do you know about your EAP? Because he was still employed at that point. And he didn't. And he didn't have any therapists. And I was like, and I flat out told him, I'm like, your back's not going to get better until you deal with some of these other issues.
Yeah.
And I think having Dr. Patel and clinicians paying attention and being able to ask those really hard questions that, you don't probably want to ask.
Yeah, we don't want to unless the employee wants to offer it. Yeah.
Right. So important in, helping people get steered in the right place, because, maybe 50% of his back pain goes away once he starts getting some of this off of his chest.
Right.
But I think that the mental health, it's good that it's more on the surface these days, but I think, helping people to get to the solutions is going to be key to a lot, unlocking a lot.
I heard a podcast recently that was talking about just that, how your mental health triggers and causes so many of, these illnesses that we have or injuries. And, until you get your mind right, it's very difficult to overcome those.
Yeah, very much. And I've worked in pain with physicians for over 30 years, and that's where it gets hung up. And when we see patients that are upset with their employer because they got hurt at work, and they're mad, or they have a vendetta for their boss, or they feel like a victim, and all these things going on at home. I mean, I hate to sound like the prophet of doom, but I know they're not going to respond to anything.
Well, and that's where I was saying like earlier about, what shaped my HR career. And it was certainly my mentor back when I was in my 20s. And something that was really important that I learned from her is being approachable, being transparent, being honest, and being a true support for your employees where they don't feel you're just pushing paper. You're doing something that's meaningful for them and they feel the sincerity that you're offering. I think that's very, very important.
Yeah, I agree. Okay, just like a couple final questions, but a big one that I'm involved in is having more clinicians involved in healthcare benefits. You've got Dr. Patel, who I know is very hands-on. Is he involved in some of your vetting of solutions or decision-making? Does he get involved in other parts of your healthcare benefits and sort of supporting you, or how do you use clinicians in building your health plan?
So absolutely. Not 100% of the time, but because Walk-On Clinic is such a huge part of our healthcare ecosystem here at Hendry, we will include Dr. Patel and the staff from the Walk-On Clinic in some of our claims meetings or meetings related to the healthcare plan strategy. Because if there's something that is glaring and we need a solution for, or we want to work on a strategy at the clinic, they're involved in helping us, through that process.
I love that because I say this a lot. When I look at data, I can see the 100-year flood that's coming.
Yes.
Right. Just did a review for an employer. No surgery, no big surgeries last year. Tons of imaging, tons of steroid injections, tons of Synvisc in the knee. And I reported back, look, you didn't have it this year, but it's coming.
Yeah.
And I can
There's
tell you.
predictability in what the data says.
Yeah.
Mm-hmm.
And I think having a clinician involved in looking at that data can also be helpful in pointing out that 100-year flood that you maybe want to plan for next year that's going to end up happening.
Yeah, and that's what I feel the need to keep speaking at conferences and really sharing what I think has worked for Hendry and my prior company in a space that's working outside of the BUCAs, but it is involving, it's not just necessarily your broker advisor, but it is clinicians that you can partner with, because we all have to be in this together. If we're going to achieve, big things in healthcare, we're not doing it alone. That's for sure.
Mic drop. That's right. That's great. I love it.
Like I said, I don't know what I don't know. So I love going to conferences and I keep meeting people and learning from them and, bringing things back that I think we can work on. But
yeah, I love seeing you at conferences, and that's it, right? We're all learning. We're all going there. I mean, I know what it's like to take care of patients. I've been involved in this space for about 7 or 8 years now on the benefits side, but I certainly don't know what an advisor knows or what, a Rosetta advisor or somebody who's really dove in knows. And I think that's where the great collaboration can make the biggest difference. Like 1 + 1 = 5 when you do that.
I mean, a great advisor will bring solutions to a company that, again, speak to the culture, the employees, the risk tolerance, but they can't be afraid to offer something because they assume the company doesn't want to hear it or won't do it.
Yeah.
They don't want to be caught being, not offering something and then the company coming and saying, why didn't you offer this to me? You didn't even share this with me.
Yeah.
I think it's important. Just lay it all on the table and lay out the plan.
And they've got an important role to sort of not know what clinicians know, but at least stay up on the solutions that make sense. I mean, I'll use Grail for an example. I like that. I don't know if you're familiar with it. It's a blood test for 50 different cancers.
No, I'm not. Now I'm going to take a note. What is it called?
Grail.
Okay. That's interesting.
Yeah. And, I'm over that age now, barely. I know it doesn't look like it.
Me too. I'm like,
but, I want to take that. I want to know, right? Would you rather know or not know? I would rather, I stay up on preventive stuff and try to remain healthy, but you never know when you get blindsided. And I've taken care of enough people who've been blindsided in their life with a disease that came out of nowhere. But, so I mean, it's important. I think where I'm going with that is for advisors to know about those things, but they don't need to understand all the science behind them or try to do their own research on PubMed, because you can go down a rabbit hole and end up down the wrong rabbit hole and find anything you want to find to support your beliefs. I think that's where working with a good clinician can really be helpful in separating the wheat from the chaff.
Completely agree. I mean, we can't be good at everything, right? We have to share what we know and share it with others. So
yeah. Well, listen, I really appreciate your time. Your insights are very valuable to me and hopefully our audience, because we're all I always say we're touching the same healthcare elephant, but I'm on the tail, someone's on the trunk, someone's on the leg. We're all describing it a little differently. But when we communicate and collectively, then we understand better.
Yeah, I mean, like I said, and I've told you this before, as an HR professional for so many years and understanding that there's different ways to slice and dice healthcare outside of working with BUCAs. I feel compelled to keep sharing it with other HR professionals because I sat in that seat and was scared to death because I didn't understand it. But I promise there's light at the end of the tunnel if they're willing to be open-minded and take a chance. So
great. Yeah. Thank you so much for sharing that and for
absolutely
continuing to beat the drum, play the drum. We all need to continue to do that.
Yes, we do.
And you've probably seen the trend where more and more people are understanding this and realize they have some control. So keep it up.
I will. That's the plan. And thank you for having me.
Yeah, thanks so much, Stephanie. I appreciate your time and insights.
Okay. See you soon.
Yep. Bye-bye.
Bye.